This is Listen Lakeland, the show that keeps you up to date on all the things that make our city a great place to live, work, and play. Today's host is the Executive Director of Lakeland Now, a community-supported local news organization dedicated to cultivating civic engagement in Lakeland through freely accessible, locally driven news. She's a graduate of George Washington University in Washington, D.C., and serves on the boards of Lakeland Vision and Friends of Colt Creek State Park. Here's your host, Trinity Laurino.
Welcome to the good life.
Thank you so much for joining us today. I'm Trinity Laurino, and it's great to be hosting this month's episode of Listen Lakeland. This show is an extension of Lakeland Vision. For over 2 decades, Lakeland Vision has been a voice for the citizens of Lakeland, working with community stakeholders to create a bright future for our city. We've got a great guest for you today on Listen Lakeland, and before I introduce him, I'm going to give you a little bit of context. So last month, on March 26th, Lakeland Vision and Lakeland Now partnered on what we called our Let's Talk Lakeland Healthcare Forum, where we got some of our best leaders in healthcare and policymakers together for an open to the public discussion on how to navigate the changes that have been happening in our local healthcare system. And my guest today was truly one of the most popular speakers at that event. I want to welcome Dr. Daniel Haight from Lakeland Regional Health as my guest today. And let me give you just a little bit of Dr. Haight's very impressive background. Dr. Haight currently serves as Lakeland Regional Health's Vice President of Community Health. He previously served as the Director of the Florida Department of Health in Polk County from 1996 to 2012, where he was the medical chairperson of the 9-county Tampa Bay Regional Domestic Security Task Force. He currently serves on the Polk County Half-Cent Sales Tax Indigent Healthcare Program Oversight Committee. He is board certified in both internal medicine and infectious diseases, and is currently a professor of the University of South Florida's Morsani College of Medicine in the Department of Internal Medicine, Division of Infectious Diseases and International Medicine. Sorry, I almost said internal there. So welcome, and thank you very much for making time for us today. Clearly, we have an expert on our hands.
Well, I appreciate the topic, and this is always an exciting time to see all the things that have been done in the past and where we're going in the future.
That's great. So let's kind of jump into it, because one of the biggest things that I think we talked about at the forum was how do patients advocate for themselves? Like, what is the best advice that you have for patients when they're going to meet with their doctor? What is it you wish your patients came to you informed with, I guess, is a way to ask that question.
Well, it's always better not to go alone. And it's not just advocating for yourself. We often find ourselves in a position where we're advocating for a loved one, a friend, a neighbor,
that's a good
someone
point.
in the community. So it's really the part where you're advocating for yourself if you're there. But because you may have a health issue, that can be very distracting. And so having to deal with that and advocating for yourself, that's where friends and family really come in handy. And of course, respecting someone's privacy. If you're helping someone else out in their health care environment, you want to make sure you're respecting their privacy, but you're there to help you make the offer. So just letting somebody know, and they may say no at first, but they'll think about it and they'll start to understand how best to go forward as you and someone that is close to you can both advocate. Because two heads are better than one sometimes with that. But the advocating part is really multi-step. It's everything that starts with understanding your insurance or making sure you've already had a primary care doctor that knows you, has a relationship that you trust, and is somebody who met you when things were not in a crisis mode or you were seriously ill or having other medical issues. It's always good to have someone who knows you when you were healthy and is there for you for temporary fixes or if something serious happens. So getting that relationship with a primary care doctor. And then if you're going to advocate for yourself, you have to be prepared. You need to go to your doctor's appointments having thought of the questions I want to ask, knowing what medicines you're on, not just the name, know the amount, the dosage, how frequently you take it. Are you running out of them? those kinds of things. Are you worried about side effects? So go prepared. And then really be proactive. Ask questions like, what kind of screening test should I get? I feel fine, but I know screening tests are meant to discover problems early. So you're advocating for yourself to discover things early so they're easier to treat. So that's a way to advocate yourself. And of course, friends and family can do that too. And then lastly, just know your rights, to privacy and decision making, and keep track of things. Keep track of your medical records, know how to access them. And you just have to stay informed. You just watching the news, reading the paper, keeping an eye on the information that your team provides. Something's new in the news, it may apply to you. That's a great question. I heard this on the news. Does that apply to me? And that's another way of advocating for yourself.
So, you talk about, coming in very knowledgeable, knowing what medications you're on, what the dosage that you're on. And I know, and I think it was probably Jason Hirschbrenner from Watson Clinic who addressed this question when we got it at the forum. But how a lot of people are basically accessing that information through different technology platforms and things like that. What are you seeing as kind of the role of technology in patient care right now, and how has that changed, over the last even 10 or even 5 years?
Well, it's becoming very powerful because you can access your own medical information, and sometimes there are explanations and information there beyond just what pertains to you, but what does it mean for you? Then a lot of different sites for good information, trusted information. I always refer to the Centers for Disease Control, can really hit on the most common medical issues. The Florida Department of Health commonly has sound advice on what needs to be addressed when your healthcare, questions come up.
Because I think, that's a concern. That's something, we sort of jokingly say, like, if you get the test result and you Google it, then it's always something dire,
And because, Google's going to put the, not necessarily tailor-made to you. And that's where you're having that conversation with a doctor who knows you well and can put it into context with not just you personally, but maybe your family history, knowing what you've gone through in life. It's somebody who really knows you.
Yeah, because I think that's the tough balance to strike right now, because it's not a lack of information. We're sort of drowning in information, but it's an ability to prioritize the quality information.
It's sorting things out. And one of the best, I would say one of the best advocates step up you can do to advocate for yourself and others is something that's promoted by the National Institutes for Healthcare Improvement. And this is the Ask Me 3 questions. Doctors would really like to have their patients ask them 3 main questions.
Okay, I can't wait to hear what these are. I'm literally going to write them down.
And it gets to what you just mentioned. Because there's so many things going on, and healthcare issues are usually not just one issue, it's a combination. And I can give examples of that. But when you have a lot going on, ask your doctor, what is my main problem? I might have heart failure, I might have a heart condition, I might have diabetes, and I might have a few other things. At the end of each doctor's visit, or sometime during that time, just ask, what is my main problem? And the doctor might respond, well, as you understand, you do have a mild heart failure, but the main issue is your diabetes right now. Your sugars have been running high. Those can cause, that is the main problem. Now, question number 2.
Yes.
What are we going to do? Okay. What is it that I need to do? This is where the doctor would explain in this example that I've given you. Well, we're going to control your sugars, but with exercise that is safe, monitoring your sugars, a particular medication, and have some goals in mind. Okay, and then last question, third question is, why is it important to me? You really got to wrap it all up in that last question. Why is it important? And in this case, the doctor might say, well, as I mentioned, your heart failure is mild, your other conditions are managed, but your blood sugar is your main problem, and we're going to do these things for it. Why is it important? Well, elevated blood sugar is going to damage your nerves. It's going to damage your kidneys. It's going to hurt your blood vessels. lead to other complications like higher risks for a heart attack. That's why it's important. Now, that makes sense. In all of this, you can ask more questions if you don't understand. And that's where having a friend there, because it can be a lot of information, someone that's taking notes or able to ask another question, or I don't quite understand, but how does the sugar affect my nerves? Well, nerves don't operate very well with high sugars over a long period of time, and you might develop burning and tingling in your feet. One of the main symptoms of diabetes that's not under control is to have nerve problems in your feet. Those are some of the longest nerves, headed all the way down to your toes. So people will get burning and achiness in their feet because of diabetes, and it's a serious problem. So you're explaining that to the patient, you're letting them know those three questions. And that's what really rolls towards advocating for yourself, because now you're trying to understand your main problem and what can I do about it? Take some action.
Okay. Yes, that is great advice. I literally wrote those three things down, and I will make sure I ask my doctor at my next appointment.
So it's what is my main problem? What do I need to do about it? And why is it important for me?
Why is it important? That is great. I want to ask too, you talked about the importance of having that relationship with your primary care doctor. Now, granted that for a segment of the population, that is going to be more challenging given, constrictions around health insurance or changing health insurance providers and things. And so it can be difficult to actually develop those relationships over time. And then, without that, I think there are a lot of people who are relying either on ERs or urgent cares and things like that. Something that a friend of mine once referred to as a doc in the box kind of places. And I'm wondering if you could help kind of educate maybe the layperson on what some of the differences are that you can find at an ER versus an urgent care, and when you should seek one versus the other.
Oh, great question. I still think it starts with that primary care doctor. We're here at Lakeland Regional Health. We are in the process of training physicians that are going to be that primary care doctor, both in family medicine and internal medicine. So there's someone who's collected very helpful information about you personally, your vaccination histories, your social histories, things that may have run in the family, and past surgeries, things like that. Now, when an issue arises and it's obviously life-threatening, 911, EMS is brought to where you're at, that is obviously life-threatening and headed towards the emergency department, where they have a multitude of tools to help a person assess whether this is truly critical and how to address it from there. But for those non-life-threatening issues, and here at Lakeland Regional, we have 3 urgent care centers, so that is strategically located around the city, so that if you feel that it's urgent enough not to wait to get into your primary care doctor that knows you the best. These urgent care centers are available with hours that go beyond your primary care provider, a little later in the evening, things like that. And they can access the information from your primary care doctor. Okay. That's improved over a long period of time. So if you're seeing a Lakeland Regional Health physician as your primary care doctor, and then you go to an urgent care center at night or on a weekend, they have access to that information. And that is helpful because there are tools there to assess whether this is unknowingly an emergency situation that could be life-threatening. And we'll do the right thing of recognizing it and getting that person into the 911 system to the hospital. An example would be, say, a 50-year-old female who has controlled high blood pressure but is noting that they're getting a little nausea whenever they exert themselves. So they had developed, and it's getting a little worse. So they go on a Saturday to an urgent care. Well, that may sound like nausea. Maybe it's a stomach problem, but no. The number one killer of women is heart disease. This could be one of the signs of heart disease. When the person's exerting themselves, some people don't get chest pressure or chest pain. They get nausea. It depends on the individual. And this is a warning sign, but at an urgent care center, they would be thinking of all the possible causes of nausea. And just like any good physician would go through the list of the most serious first. So certainly nausea could have something to do with the stomach, but it could have something to do with the heart. They will assess that, and if they have that concern, that would be addressed in the emergency department. If they're able to rule that out, they'll be able to have that addressed there so the person can get care and then communicate back to the primary care provider, who will know what to do when they see them on Monday or the next day.
Okay. All right. Well, I mean, that sounds so sensible when you say it, the difference between the urgent care and the ER department. But, having been in that situation where, the kid's got 104 fever and you're trying to figure out what do I do, where do I go?
Exactly. And a lot of, I think parents and everyone do fairly good job. I mean, if somebody has a seizure or if somebody is vomiting up blood, that's an emergency room visit. So I think we do a good job of raising people's awareness of when you should go to the emergency room. Chest pressure and pain that won't go away. That needs to go to an emergency room. Could be a heart attack. It might not be, but they'll find that out. But then there's the issues that could be confusing. Abdominal or belly pain could be a serious problem, but it may not feel that serious. And we were going to talk a little bit about the health of the community. We have people walking around with very high blood pressures, and they don't know it. Blood pressure being elevated is silent. You don't always feel it, but it's doing its damage. It's hurting the kidneys, hurting the eyes, hurting the heart, but it's putting you at risk for stroke. That could happen tomorrow or next week or next month. What an awful thing to happen that could have been prevented if the person knew that their blood pressure was high. But once the stroke occurs and the person can't move on one side of their body, can't talk, they're having facial weakness, that becomes an emergency. And, getting to the emergency room quickly, at Lakeland Regional Health, we can actually recognize whether this is a stroke and try to take steps to reverse the stroke.
I'm going to pivot a little bit because you mentioned that Lakeland Regional Health is now a teaching hospital. So that is a very new program. Do you want to tell us a little bit about how that has come about?
Well, certainly academic medicine and academics in any area, I've always enjoyed, no matter where in the community. You could have an academic bank. You could have an academic, grocery store. I mean, just bringing people in so they can learn about careers. But we have a huge issue on addressing the access to care and bringing from the outside, people who have graduated medical school, they're physicians, they're wanting to learn, they want to get involved in the community. They're coming here to Lakeland Regional to get the further training in areas such as surgery, psychiatry, family medicine and internal medicine, and emergency room medicine. Those programs really are taking some very enthusiastic, energetic people that will likely stay in the community. So this is a big plus for the community. Having almost, when the program is done, developing about almost 200 residents that are going to be in training to be local physicians. Some are learning how to take care of us as we get older, geriatric issues, understanding how to care for patients in nursing home facilities, skilled nursing facilities, especially in our mental health area. This is very much in need. And so the hospital has recognized, and Lakeland Regional Health had seen, that some of the best centers in the United States are academic centers. So developing those centers, bringing in the experts that know how to teach the residents and help us really, create an environment of learning. And it's benefited everyone. And even if you're not in the program, the other physicians are going to the lectures, attending the informative sessions, and we see the benefit in our patient, and it's improved access. Now these doctors are able to help and see patients in need throughout all these areas.
And it sounds like it's, a sort of a long-term plan to help increase recruitment to this area for these medical specialists.
Exactly. It's much better than having a medical school, because when you finish medical school, you enter into a match process which could send you anywhere in the country. So that doesn't necessarily mean that a medical school locally will have the students that graduate stay locally. However, what we're doing at Lakeland Regional Health, by training physicians that get to meet other physicians, chances are they'll tend to be hired locally. And they love the area, love the Lakeland area. So that really helps, us develop our clinics, and our, patient population is going to get used to that. These medical residents are, it's just wonderful training them, because they're like sponges. They just pull in all the information. They really sit down and listen to the patients.
And that was something that came out in the forum too, is that Polk County is considered medically underserved, and with this rapid growth that we've been experiencing for, I think, over 4 years now, that we don't have enough doctors or even nurses, I think, to serve the population that we have currently.
Yes, and Lakeland Regional, working with both those who train nurses, and of course training the physicians, to recognize this area of shortage, so that you can get into an appointment. You can be able to have it not too far away, and it's located near you. So as the hospital's developed additional services in neonatal intensive care or in bariatric surgery to help folks that are overweight in other areas, this is helping people stay locally.
Well, that was going to be my next question, actually, is, over the last decade, what services have you seen be added that were needed here? And then the flip side of that question is, what are we still missing from the community?
Well, what has been added that's been extraordinarily beneficial is inpatient rehabilitation. If you've had a car crash or a hip replacement or something that's needed extra physical therapy, within Lakeland Regional Health, the Banish Institute has really helped a person and family stay local so as to get the strength back so they can be successful after they leave the hospital. So rehabilitation services has been a big plus at the Banish Center. And both for mental health and behavioral health, there's a significant amount of folks that are dealing with multiple issues, some of them including depression, anxiety, post-traumatic stress, and developing the Harrell Family Center for Wellness has been a big benefit when it comes to mental health, both inpatient and outpatient. That center just opening up recently, again, has helped people get the services they need, and not just as in the hospital, but outside the hospital in the clinic setting. That's benefited also. You mentioned urgent care, and just at both our Kathleen office there on I-4, having both urgent care, specialty care, and primary care in that one location. But some of our other sites, like off of South Florida, we call it the Pablo Building. That's urgent care also, and down a little further south, Lake Merriam. And even alternative ERs that are being constructed in the future for Lakeland Regional Health that will help give other points that are closer to where you live.
So that flip side of the question, let me ask it in a way that is a little bit different, because it's not that it's not a judgment of the services that we have now, but if you had unlimited resources and you could snap your fingers tomorrow, what would you add to the hospital or the ecosystem at large to fill a need that you're seeing?
Well, I think a number of services go back to how we assess the community and what we see. So, for example, our Hollis Cancer Center has been really addressing the cancer needs of the community, whether they needed chemotherapy, surgery. What I see developing is more services in cancer that also integrate the two, because as a person who may be going through cancer, it's not just one doctor treating one disease. It might be a team. And I see that developing even further, where it's not just cancer needs surgery or chemotherapy. A person may need radiation therapy. So there you need a team of people. And then during all that, keeping an eye on how the kidneys are doing, a nephrologist. And so we've developed these service lines where we've added those physicians over the years to be in multiple specialties, rheumatology, endocrinology, these different specialized fields. That way you don't have to travel a distance. And so just adding more of those areas of expertise. But that's where I've seen we've started well with the Hollis Cancer Center, and also moving out and adding even more ability to treat. The other thing that is happening that's a big plus is research, being able to be on the cutting edge and doing and finding out what would help our community the most when it comes to accessing newer treatments. Because that's what you're reading in the news all the time, is a new therapy for this or new treatment for this. But we have to make sure that these treatments are safe, they're effective, and they're the best for our patients and our community. Being able to do the research here locally is actually very beneficial, because we're such a good mirror to the general average population throughout the United States, as opposed to being a major center, which is a little skewed to the out of the ordinary things, the very rare things. Our community has things that happen every day. So doing research in the Lakeland area is also helping understand, what is needed, what does our community want to better understand treatment. So I can see that is another step we're taking in the future, is to be more involved in that.
But are there specialties or things that you're still having to refer people out to, say, Tampa and Orlando, that you wish we had in the community?
Well, there are things that we're not there yet, but very severe burns. Those go to burn centers, and they are strategically located throughout Florida. So I'm on staff at Tampa General, so I see patients sometimes, because I'm an infectious disease specialist, I'll see patients at the burn center at Tampa General. Now, these are very severe, very intensive care issues. And as the population grows, those things will appear in more places in Florida. Organ transplantation, again, very complex, complicated area that patients do have to go to centers across the United States to assess what is needed, the best match, and how to follow somebody up. Because once you have an organ transplant, we do care for those patients, but because at that point their immune system is low and they can develop other problems. But we do it in connection with whatever transplant center did the original transplant. People do move around. And with transplants, that's one of the things to get back to a normal life. So people with transplants do move into the area, and they not only establish with the transplant center, but they may come to the local hospital here at Lakeland Regional, and we'll care for them and their needs in communication with the transplant center. And if they have to be transferred out for something unique, that would be what happens. Those are two areas that are not locally at this point, but again, those are the things where there's only very few of them in the state of Florida.
Well, I want to say thank you again for your time today. I do also want to mention that we have another event coming up this year. Lakeland Now and Lakeland Vision are partnering on several events all around healthcare. And our next event is going to be a candid conversation event that is focusing on the intersection of mental health and policing. We have a fantastic speaker. It's Professor Risden Slate from Florida Southern College. He's a professor of criminology, but he also has a personal and very impactful story of his own mental health journey. And so I'm hoping that you will all join us for that on May 14th, and it is going to be, and let me say the name of this building right, the Florida Conference of the United Methodist Church building, which is right next to LVIM's building, and you can find more information on that at lakelandnow.com. That's LKLD.com. And with that, I just want to say, Dr. Haight, do you have any parting words of wisdom for us today to keep this community healthy and on the right track?
Well, certainly be proactive about preventative care. Make sure that you've checked your blood pressure, you know what your blood sugar is, you know your numbers, and you're in communication with your doctors, because they may say, well, you're getting to that age where a colon cancer screening is needed, lung cancer screening if you've smoked cigarettes in the past. So just make sure you can catch things early. It's much better to do that because you avoid some of the complications of discovering things late. But again, thank you again for the opportunity.
Well, thank you. And thank you out there for tuning in to Listen Lakeland. Your feedback is valued, and we encourage you to head over to lakelandvision.org to participate in our monthly survey related to today's show topic.
I said, welcome to the good life.
Listen Lakeland is brought to you as a collaborative project between Lakeland Vision, the City of Lakeland, and Hall Communications, a community working together to provide an exceptional quality of life. Thank you for being with us.